In this week's edition of A Health Report, one local gynecologist explains the creative ways now being employed for protection during this COVID-19 pandemic. Dr. CATHY MADDAN also provided tips on how pregnant women can protect themselves as well. Shamela Pullen reports.
As is the routine now at most health facilities, pregnant women are now being screened before they can see their healthcare provider. Consultant gynecologist and obstetrician Dr. CATHY MADDAN says while social distancing is impossible with this group of persons because they will have to be examined and babies will have to be delivered in some instances, the screening process is critical. And even with the limited resources, which includes personal protective gear, PPE, Dr. MADDAN says she and her colleagues have to find creative ways to protect themselves.
Most would wear a separate change of clothes once they have to come in contact with the patient and wear something like a gown over that. There are some people I know out there, I have colleagues who are going to start laughing, who are actually wearing eyewear at some points. Those who wear glasses are okay, but then for those of us who don't wear glasses, they wear a particular protective eyewear while they are seeing the patients. So we try to do that to protect ourselves.
Which is why she's calling on pregnant women to stay inside as much as possible. She says while there is no evidence to say they are at added risk for COVID-19, they need to protect themselves like the rest of the population.
Have someone in the house dedicated to going out and make sure that the persons that you live with are aware that your situation is delicate, and they too must practice the good hand hygiene and wearing a face mask while they are out. If you do have to venture out, please cover your noses and mouths so that you reduce the risk of transmission. It does not have to be a fancy mask. You can use a scarf or you can make your own mask. Other simple things that you would probably don't think of when your contacts come into the house: don't let them wear the same shoe that they had on outside. Leave it at the door, and as soon as they get in, they go in and shower and change their clothes.
And pregnant women need to try and boost their immune systems by taking prenatal vitamins as recommended by their physician.
Your groceries, wipe them down with a little soapy water with bleach in it. And if you do have to buy food from outside, be careful about those containers. So preferably discard the container, sanitize your hands, and reheat food if you can.
With your health report, I'm Shamela Pullen wishing you good health.